This program provides information on bloodborne infections and their prevention. OSHA's Bloodborne Pathogen Standard and the CDC Standard Precautions Guideline will be discussed. However, this course should not be treated as a comprehensive infection control training program. Healthcare workers should learn and follow additional infection control procedures to prevent transmission of other types of infection. Since the advent of AIDS and HIV, there has been increasing concern about preventing the spread of HIV infection and other bloodborne diseases. In response, various government agencies have issued and updated recommendations and enforceable standards to address the dangers of acquiring bloodborne infections, such as AIDS and hepatitis B and C in the healthcare environment. This video has been designed to take a detailed look at work practice controls used in healthcare settings to prevent the transmission of bloodborne infections. OSHA requires all healthcare facilities to comply with its bloodborne pathogen standard. This regulation is designed to protect workers against exposure to bloodborne pathogens through infection control strategies, such as universal precautions and the use of personal protective equipment. In addition to these strategies, OSHA requires that other work practice controls be observed. Precautions must be taken when handling sharps, working with lab materials, decontaminating care areas and equipment, handling laundry, and disposing of regulated waste. The CDC estimates that 600,000 to 800,000 needle stick or other percutaneous injuries occur annually among healthcare workers in all healthcare fields. But, it said, this number could be reduced by 62 to 88% through the use of safer medical devices. In light of this, OSHA's Bloodborne Pathogen Standard requires the use of engineering controls to help prevent sharps and needle stick injuries, and a number of safer medical devices have been developed. Safer medical devices can be of two types. The first are sharps with engineered sharps injury protections. These are non-needle sharps, or needle devices used for withdrawing body fluids, accessing a vein or artery, or administering medications or other fluids with a built-in safety feature or mechanism that effectively reduces the risk of an exposure incident. The second are needleless systems. A needleless system is defined as a device that does not use needles for the collection of bodily fluids or withdrawal of bodily fluids after initial venous or arterial access is established. The administration of medication or fluids or any other procedure involving the potential for occupational exposure to bloodborne pathogens due to percutaneous injuries from contaminated sharps. When evaluating and selecting a safer medical device, you should also consider these 7 safety characteristics of an effective safety device that were identified by the CDC and NIOSH, the National Institute of Occupational Safety and Health. First, devices should be needleless. Second, the safety feature should be an integral part of the device. Third, the device should work passively, requiring no user activation. Fourth, if user activation is needed, it should be able to be done with one hand and allow the hands to remain behind the exposed sharp. Fifth, the user can tell if the safety feature is activated. Sixth, the safety feature must remain active and protective through disposal. And seventh, the device must be reliable, easy to use, practical, safe, and effective for resident care. Employers must develop an exposure control plan, and in doing so they must consult those who use sharps regularly on the job and evaluate the safer medical devices available. This includes getting input from non-managerial employees responsible for providing direct patient care. Safer devices must be used wherever possible, and all healthcare workers must be given hands-on training in their use. OSHA also requires documentation and record keeping on all needle stick incidents. Information to record includes the type and brand of device involved, the department or area where the exposure occurred, and an explanation of how the exposure occurred. This will serve as a tool to help identify high-risk areas and procedures. If these reports are used for other purposes, the confidentiality of the injured employees must be preserved. These needle stick reports, plus other information relevant to the exposure control plan, must be continuously monitored. Also, as newer safety devices become available, they must be evaluated as well to see if they are better than the devices currently used. These evaluations are part of the annual review of a facility's exposure control plan, and the office is subject to monetary fines if any OSHA directives are not followed. If you must use conventional needles, contaminated needles and other sharps must be handled safely. Because needle stick injuries can expose you to infectious blood or other body fluids, you must observe the following safety rules. Never bend, break, or manipulate used needles. Immediately discard used disposable sharps in containers that are clearly marked, closable, puncture-resistant, and leak-proof on the sides and bottom. Sharps containers must be readily available and must be replaced before they become overfilled. Do not recap used conventional needles unless absolutely necessary. If recapping is unavoidable, use the one-handed scoop method or a recapping device to prevent accidents. Work practice controls must also be used when handling lab materials. For example, precautions must be taken when handling lab specimens such as blood or urine samples. For transport of specimens, put them in containers that prevent leakage and are marked with the biohazard label. To protect others who may handle it, make sure the outside of the container is not contaminated. Warning labels must also be applied to storage containers, such as refrigerators or freezers that are used to store blood or other potentially infectious materials. Items such as food and drink should not be stored along with lab materials or in other locations where potentially infectious materials are present. When working with lab materials, be sure to never pipette by mouth. And use a biological safety cabinet whenever procedures involve a risk of splattering materials. And do not eat, drink, smoke, apply cosmetics or lip balm, or handle contact lenses in work areas where there is a reasonable likelihood of occupational exposure. Special precautions and techniques must be used to decontaminate work areas, instruments, and equipment. Proper cleanup of spills can help to protect yourself and others from exposure. Always wear gloves for this type of cleanup. First, wipe up the spill with a towel. Then carefully dispose of the contaminated towel. Apply a germicide or bleach mixed with water until the surface is glistening wet. Keep it moist for the manufacturer's recommended exposure time, usually 5 to 10 minutes. Then allow the surface to air dry completely. Standard cleaning and disinfection procedures apply to care areas. Wear gloves and use EPA-approved products. Your supervisor should tell you what products to use and how to use them. In addition, disposable protective barriers may be placed on surfaces and objects in a treatment area that may become contaminated during a procedure. These coverings should be discarded and replaced with clean coverings after use with each patient. Instruments soiled with infectious material should be handled carefully and cleaned and sterilized in the usual manner. Usually an ultrasonic cleaner is used to remove solid particles, and an autoclave is used for sterilization. Be sure to maintain the effectiveness of the equipment and to follow the manufacturer's recommendations. If equipment is to be picked up for repair, make sure it is decontaminated to prevent infection of others who may handle it. If portions of the equipment cannot be decontaminated, attach a warning label that identifies those portions so that precautions will be taken by repair personnel. Linens contaminated with blood or other risky materials should be handled as little as possible. Protective gloves should be worn. Never rinse or sort linens in care areas. Instead, carefully bag soiled linens right where they are. When handling soiled linens, avoid skin contact and roll them away from your body. Contaminated laundry must be placed in an appropriately designated container that prevents leakage or soak-through. If the laundry facility is off-site and does not utilize universal precautions or standard precautions, the container must be labeled or color-coded. If a laundry container is damaged or if the outside is contaminated, carefully place it inside another qualified container to protect others who may handle it. In the case of linens, dishes, glassware, and eating utensils, neither HIV, HBV, nor HCV can live through standard laundry and dishwashing cycles. Items like used gauze pads or used gloves should be handled and disposed of carefully. Waste that is wet or dripping or that oozes fluids when pressure is applied is regulated waste. It must be placed in containers that are closable, prevent leakage, and are color-coded red or clearly labeled biohazard. Laws may require that these materials be collected separately from other trash. If a waste container is damaged or if the outside is contaminated, carefully place it inside another qualified container to protect others who may handle it. Check with your supervisor to find out where and how to dispose of the waste. You should also take special care with your personal hygiene and health. The most recent CDC guideline on hand hygiene recommends hand decontamination before and after direct contact with a resident, before and after wearing gloves, after touching resident care equipment or environmental surfaces, and before performing invasive procedures. In all these situations, the preferred hand hygiene technique is now decontamination with an alcohol-based hand rub. This has been shown to be more effective against microbes and quicker and easier to perform, thus encouraging greater adherence to hand hygiene. The manufacturer's recommended amount of the agent should be applied to the palm of one hand, then the hands should be rubbed together so the agent covers all surfaces of the hands and fingers. Rub until the hands are dry and do not rinse. At the start of a shift, when hands are visibly soiled or when there's a buildup of alcohol product, hands should be washed with soap and water. The recommended washing technique is wetting the hands first, apply soap, then rub hands together for at least 15 seconds, covering all surfaces of the hands and fingers, followed by thorough rinsing under a stream of warm water. Hands should be dried with a disposable towel, and the towel should be used to turn off the faucet. To ensure the effectiveness of hand washing with soap, liquid soap should be used. Disposable soap containers are less susceptible to contamination than those that must be refilled. Because it is possible for a pregnant woman to become infected and to transmit blood-borne infection to the unborn child, pregnant healthcare workers can protect themselves and their unborn children by adhering to precautions. If you have an oozing wound or sore, or if medications have weakened your immune system, consult your physician or employer. Special precautions may be necessary. There are many ways to protect yourself and others from blood-borne infections like AIDS, hepatitis B, and C. Be sure to follow all work practice controls and learn the specific precautions you should take for your particular job. If you apply what you have learned on a daily basis, you should be able to perform your job safely and with confidence.